Recognition. Mr. Mack.
Thank you, Mr. Chairman, and I also would like to thank the ranking member. I think we all recognize the importance of today's markup and the gravity to which decisions that are being made here today, and certainly no one is new to the arguments and debates that have been made. And I think both certainly the ranking member and the chairman have done a great job of outlining what's before us and what the debate is, and certainly the American people understand and recognize what it is that the Congress is about to do. This first motion to instruct would prohibit the use of comparative effectiveness research or other measures to restrict medical professionals from providing and or prescribing the care they believe to be medically necessary. And I think this really goes to the core of a lot of the frustration that you're feeling or that you're hearing from the American people. The American people want the relationship between themselves and their doctor to be preserved. They do not want to see the federal government, bureaucrats, and politicians making decisions that would have a negative impact on themselves and their families and their lives. The idea that somehow a bureaucrat or a politician knows what's best for a patient is absurd. And what we're saying is let's preserve that relationship, that doctor-patient relationship. And let's think about this for a minute. And if I may, I'm just going to give you a little family story here. I had an Uncle Mike who passed away of cancer at a very early age, and it was his doctors that really provided the care, and it was the family meeting with the doctors that we could talk about what's best for him and how to get through his illness and what procedures to take and what tests and what medicine, and it was very personal. Later on down the line, my grandfather died of cancer, and again, it was that relationship between my grandfather, our family, and the doctor that helped set a course that we used to try to fight cancer and try to win and try to extend his life. Later on, my mother got breast cancer, and she survived. And again, it was that relationship with her doctor that she was able to, and as a family, talk with the doctor about what is the best course of action. Now imagine if somehow there was a Washington bureaucrat or a politician that was in the mix. That is not, the last thing in our mind when my mother was fighting her breast cancer was the idea that government somehow was going to control what kind of procedure she could have, what medicine she could have, what the proper course of actions were. It was the doctors and my mother and our family who made those decisions. Again, later, my father ended up with melanoma, and he survived. And he survived because of the relationship between my father, our family, and his doctor. Later on, my sister got cancer. And again, it was that relationship between the doctor, my sister, and our family. Not a Washington bureaucrat, not a politician that made those decisions. The American people are saying loud and clear, hands off, stay away. We do not want you involved in our health care decisions. This is a very personal decision for many people. And lastly, I just would like to say this. I have a young daughter and a young son. And as they grow older, what's going to help them through their challenges in medicine is going to be the relationship between the doctor and them. If we do not move forward with this motion to instruct, I'm afraid that it's going to be the Washington bureaucrats, government, it's going to be politicians that are going to decide the care of my children. and your children. The American people have said loud and clear they do not want government involved in the decisions that are being made on their health care. They want to preserve that for the doctor, for themselves, and for their doctor. This is an important motion. I think this goes to the heart of what the frustration, the fears are with the American people. And I would hope that, that all of my colleagues on both sides of the aisle recognize the importance of this and will support this motion to instruct. And at this time, I'd like to ask the Congressman Austria if he'd also like to make